Hello, everyone. I want to start out by thanking all of our viewers out there and welcome you all to Medical Student Grand Rounds. I am Bryce Ringwald. I'm a fourth-year medical student and Vice President of Student Council. Medical Student Grand Rounds is a lecture series that we started back in the fall, back in October, that is given really to inspire medical students. This series, it occurs on the first and the third Tuesday of the month, starting at 12 p.m. and has been conducted via Zoom. We will continue to do that for the foreseeable future for right now. Today we have a fantastic presentation lined up for you all. Jessica Muñoz, the fourth-year medical student, she's going to be presenting on the social determinants of health, mental health, and underrepresented minorities from a Latina medical student perspective. And then on February 16th, we're going to have a complimentary talk by Carissa Newkirk, who's going to be talking about mental health of underrepresented minority students from the Black medical student perspective. So very good back-to-back presentations for you all coming up. We also wanted to make you aware of our YouTube channel where you can view all of our past presentations. To do this, just log on to YouTube, search Medical Student Grand Rounds, Ohio State, and be sure to subscribe to the page to get updates when we go ahead and post new lectures. During this talk, we'll also be utilizing the Q&A function for questions at the end. Throughout, just feel free to put in your questions and we will do our best at the end to get to all the questions that you have for Jessica. And now without further ado, it is my great pleasure to introduce Dr. Linda Stone for today's introduction.
Today, we will have the privilege of listening to Jessica Muñoz. She will be sharing with us a presentation entitled Building Resilience in the Face of Adversity, a Latina Medical Student Perspective. As a senior medical student about to embark on the next phase of her medical training, Jessica hopes to share a message that has been part of her personal and professional growth here in the OSU College of Medicine. It is not easy being the first generation in her family to seek higher education, much less enter and graduate from medical school. From West Chicago with strong roots in the Mexican-American community, she was determined to always look to the future. What would be next if she only imagined it? Where was her life path taking her? And who was she called to serve? Her journey led her to many challenges. From those difficult days emerged a soon-to-be physician that is a role model, a leader, and an advocate for the underserved. Everywhere she looked, there was a need for her talents, her experiences, and her commitment to medicine. Saturday morning, she might be found mentoring a high school or college student during a Bowen Circle tea. No question was too small to answer. Every person deserved to be heard and advocated for. As a recipient of the 2017 Clotilde Bowen Award and Scholarship for Women of Excellence, she has consistently returned to the Bowen Circle to support the young women seeking a life in medicine. Never one to turn away from the difficulties of others, she became involved in research concerning mental health and medical students. Bringing a wellspring of compassion and empathy to this challenge, she reached beyond the research to find new ways to serve. If the difficulties of the day weighed heavily on her, she turned that into seeing those difficulties in the eyes of others, and then setting about to do something, to take action, to become an advocate who would make a difference. Like so many students tackling the study of medicine, she was faced with adversity, faced with those that expected her to fail, and faced with the mountains of knowledge and skills that were part of the pursuit of the MD degree. Again, she took her own challenges, at times despair, and used those experiences to push back against those that did not see her talent, her commitment, her compassionate and caring nature, or her strength. Taking the force of those who might be critical, she turned that force into her own strength. She would persevere, and she would continue to find her personal strength by simply believing in herself. We all come to points in our lives in which we are challenged and dismissed. Jessica's story is one of hope, audacity, honor, and love. Please join me in listening to Jessica's story of inspiration and transformation. Jessica?
Thank you so much, Dr. Stone. That was beautiful. Thank you again for everyone who's joining us today. It's a pleasure to have you all here and to share my story. It's definitely not a lecture. I just want to share the struggles I've faced, who I am, and what I'm all about. So I am Mexican American. Both of my parents are immigrants from Mexico who came here in the 80s and with very little education. My dad has a second grade education. My mom has a third grade education. They were forced to work the land and were not given the opportunity to go to school because they had to provide for their family and find money to feed their own siblings. And so for me, being able to have made it this far is really a privilege and an honor. And I'm thankful that I've made it this far. It's been definitely difficult having to be the first person to become a physician. My parents actually were not in support of me going to college. My dad wanted me to finish high school and to help pay for our mortgage and our bills. And so when I told them that I wanted to go to college, it was definitely a conversation of a lot of arguments. But I decided that I love science and that I wanted to help my community by becoming the first physician in my family, one who spoke Spanish and really cared about my community. And I want to talk a little bit about my education prior to high school because it definitely was a challenge. I have parents who don't speak English, and so I was in all English classes until third grade, and so it was English for as a second language from the beginning up until third grade. And so I remember them when they switched me that I felt very out of place. They, the students in my own English classes didn't look like me. I was one out of three Latinas in that class, and I felt very out of place. It was culture shock at such a young age. And I was very quiet, mostly because I felt like I didn't fit in. And that was a struggle through primary school. Then when I went to middle school, they placed me in honors classes. And I remember I asked my pre-algebra teacher a question. She's like, Jessica, perhaps if you have so many questions, you shouldn't be in this class. And I was so upset and so disheartened. I went home and I cried about it. And I told my mom, maybe I don't deserve to be in this class. Maybe I'm supposed to be with all the other people who look like me. And she's like, you know what, Jessica, like, I'm not going to let you give up. You're going to find a way to make this work and we're going to get through this. And I went to my neighbor who lived across the street, who happened to be one of the only white people who lived in my neighborhood. And I asked her to tutor me for free. And she said yes. And I ended up getting one of the second highest grades in that class. And I was just so happy that someone was looking out for me and helping me, and that I didn't listen to that teacher who doubted me, and I pushed through. And I think that story and that resilience has pushed me through all of medical school. Even when I was applying to medical school, I ended up becoming the commencement speaker at my college, which was for my parents like a huge moment of, we didn't support our daughter because we were afraid of not being able to help her financially and academically because we never experienced going to college. And for them to see their daughter become the commencement speaker and represent their class was a huge moment of just, honoring all our hardships and how far we had come as a family. And I had to take the MCAT again. I had to retake it, and I didn't do well. And so they were concerned that perhaps medical school wasn't for me and that all I had done in undergrad maybe wasn't worth it. So it was definitely a difficult time. I ended up not doing well on the MCAT because I didn't have the resources. I come from a family who doesn't have a lot of money. They're, hardworking, but we just don't always have enough money to pay for bills and mortgage. And that was all of my childhood, having to worry about how are we going to pay for this, coming home and thinking, I can't join the sports team because we don't have money to pay for that right now. And so I think it's important to know that for some of us, like myself, we don't always have mentors or people who look like us, who are pushing us or who are having conversations about college, about, higher education. I was 21 the first time I met someone who looked like me, who believed in me and said that I could accomplish anything. I mean, 21 years old. I think that You know, it's crazy to think that it took that long. You know, her name is Dr. Vega. I met her when I found a free Kaplan course for the MCAT down at University of Miami, and she changed my life. I met her when I was in the lowest point of my life because I retook the MCAT. I felt like a failure because I didn't do well. And she made me realize I didn't do well because it's not that I wasn't smart enough. I didn't have the resources because of my upbringing, because, you know, we didn't have money to pay for that course. And I didn't have the experience to take these standardized exams. And so I took the course and it changed my life. I regained my confidence back after having to retake that test. I got multiple interviews at many different medical schools. I got offers at different schools and even scholarships. So my MCAT score went up drastically, like exponentially. It was just crazy what happens when you have the right resources and the right people rooting for you. And I wanted to share this quote by Sonia Sotomayor, which really, you know, puts into perspective what it's like to have someone who looks like you in flesh in front of you who has accomplished so much. So I'm very thankful for her. We still keep in touch. Mentoring is a huge part of my life because I lacked mentors growing up. And I sent all my mentors to the MCAT program. And almost always one of them gets in every year. So I'm very thankful for her and all the people who've supported me along the way. When I came to medical school, I decided obviously to come to OSU because they really talked a lot about diversity, and that's something that was really important for me. And it was definitely a culture shock. I felt like I would see more people that looked like me. And obviously, if you look at this chart here, you know, of people who are in medical school, Hispanic, Latino, or Spanish origin, which is what I consider myself, there's only about, you know, in 2020, about 6% of Hispanic Latina females in the entire country, only 6%. And if you think about what that is, when you apply that on a national level, there's very few of us. So we're very rare. And it kind of sucks when you don't see people who look like you in the classroom, and people who teach you don't look like you, the doctors don't look like you know, and that's something that really, you know, it contributes to the imposter syndrome of, do I fit in medical school? Am I smart enough to do this? I don't know anyone in my family who's done this, you know, and I'm trying to break all these generation curses and, you know, trying to keep moving forward. And it definitely does have an impact on how you see yourself and what others think about you as well. So imposter syndrome has definitely been a challenging, but you find ways to keep on pushing on. And I also want to talk about being a minority and how there's a very wide range spectrum of what Latinx is. There are so many different Latinos and groups. I mean, there's people from all over. A lot of people assume that all Latinos in America are Mexican, but there's Puerto Ricans, there's Colombian, there's just so many of us. And we are, you know, we all come from different backgrounds and have very different experiences. My experience as someone who looks very Latino is very different than someone who might be of white passing Hispanic. And even though they identify as Latino or Hispanic, they might not be perceived as that. And so there's privilege that comes with being of lighter complexion. And it's important to know and understand that my experiences are different than other Hispanic and Latinos. And also that you can't group all minorities into the same group, that my experiences as a Latina are very different than my friends' experiences who are Black or African American. And so I think it's important to step back and just make an effort to get to know people who don't look like you, who come from different religions, different backgrounds and cultures, and really understand, you know, the needs of those people and how we can try to better the world around us. So obviously, you know, being Latina to me is extremely important, is something that I really care about. And I wanted that community at OSU, and I unfortunately felt like I didn't find that here. And I wanted to make a difference and create that for other students. And so I was really focused on creating that community and engagement among medical students, especially the Latinos. And so I became the president of the Latino Medical Student Association. And through that, I created a lot of opportunities for mentoring for high school students in Columbus, as well as advocating for DACA, the Deferred Action for Childhood Arrivals, giving undocumented students the opportunity to study in America and not worry about being deported. And so we called our representatives, we had lectures that, you know, I created and I gave, and something that I'm very passionate about. But I will say that having to create this balance between community love and education can definitely feel burdensome at some points, because I want to do everything and I care about all these issues. And often you find yourself being the only one who's doing everything. And then you don't study as much as you probably should in medical school. But I care about all these things, and that's why I do it. And, mentoring again is a huge part of what keeps pushing me to give back, because I want little kids who look like me to know that they can become physicians and lawyers or anything they want to become. And so it's important to give back to our communities, but you definitely struggle with maintaining that balance. Something that really has, had an impact on my personal mental health is the news of all the people at the detention centers, all the children who have died in detention centers because they didn't have access to healthcare when they were detained and their families were detained. And so all these inhumane, like, social injustices that happen at these private detention centers really impact some of us, some of our classmates. And it's important to just know that, like, hey, these things are happening and we should all care about these issues. It shouldn't be only people that look like me who are trying to have a voice for these marginalized populations. It would be nice to see more people stepping up and showing their support. I personally was really, hurt by all of these situations that were happening at the border, because it's people who look like me, but I also know, personally, I know people who have been or are in detention centers. And so I can't just be silent and not do anything about it. And so I organized, as a second-year medical student, I organized a protest down in Cincinnati and at the sheriff's office, where we talked about improving what's happening at private detention centers. And I actually only had one other medical student from Ohio State come with me that day. And I know it was far, but I wish I would have had more support from the students at OSU. We did have some undergrad students who went and helped us. But again, it's these issues of who cares about what's going on to people who look like me, people who are suffering and in pain and dying in these institutions. So here are just some more pictures of my involvement in leadership and service. This was at the protest that I was telling you guys about. Basically, I was just sharing why it's important for these individuals to get healthcare once they're detained and have just like basic supplies like toiletries. And so this pushed me to join the Doctors for Camp Closure, which you guys can all join. Basically, it's all physicians all over the country and medical students who are using their voice to improve the policies that are, affecting the people who are at detention centers. Over here, we had an event that I led through the LMSA, where we were pushing for the Senate to pass the humanitarian standards for individuals in customs and border protection. So basically, what I was doing at the protest, we were doing it just like in a different way. There's different ways for you to use your voice. And sometimes you have to do it where you just show up at a sheriff's office. Other times you do it through social media, through calling your representatives, but finding ways to improve the situations of the marginalized populations in our country. Over here is a picture of us volunteering at the Clinica Latina, which is here in Columbus, Ohio, where we are spending time just taking care of those that are undocumented, uninsured, and not insured, and listening to them. I think it's so important to listen to the needs of your community and figuring out what is harming them, what is preventing them from getting access to healthcare, and how can we become their advocates and be their voice. These are some more pictures of the LMSA National Conference in DC. I made a lot of amazing friends. We are still in touch, and we are all really working towards improving access to healthcare for the undocumented population in the country. And I'm just really excited because we are all super involved with policy, and I know that a lot of us are going to be running for office in the future. It's important that we as physicians think about those things, because I personally want to make a difference, not just locally but go beyond the walls of the hospital, but also nationally, and change, these policies that are affecting our patients and their access to care, whether that's insurance, transportation, not having access to healthy food. There's so many issues that we really need to work on fixing so that we can actually practice medicine in a way that will be beneficial to these patients. So I wanted to talk a little bit about diversity here. Diversity, for students like myself who come from low income, first generation, it's so important that we focus on more than just recruiting diverse students, but how do we retain these minorities? I personally saw a lot of minority students struggling in medical school and as a first year medical student, and I wondered, is that going to be me? Am I going to fail? Am I going to have to repeat a year or take a year off? And so those things really affect your mental health, your anxiety. And I really want to just give a huge shout out to Miss Goldsberry, Miss Nikki. She's the Associate Director of MedPath, which is one of the post-bac programs that we have at OSU. And that's really, helping diversify our medical school. And she's just a phenomenal person. I personally didn't do MedPath, but a lot of my friends did MedPath. And I'm so grateful for that program because I've met amazing people and they all deserve to be here. And we need to continue to support people like Miss Nikki because she really is someone we go to all the time that advocates for us, who listens to us, and she's doing all that she can to support us, but there's still a lot of work that needs to be done. I think it is definitely our responsibility as an institution who prides itself on diversity that we continue to have better retention efforts. How many of these minority students are actually graduating on time? And if they're not, why are they not? We need to do research. We need to make sure that we are implementing things that will help these students graduate on time. And we also need to focus on allowing people of color to climb the ladder outside of just diversity and inclusion, because our perspectives are valuable and important in many other ways as well. So Ms. Nikki has really made a difference in so many of our lives, and I'm very thankful for her and everything she's done for me. So with that, I want to talk about medical school challenges because obviously I was really involved. I'm still very involved, and sometimes that can take a toll on you and your mental health. I felt like I was doing so much extracurricular stuff and I had less and less time every year focused on studying. And so I knew I had test anxiety because I retook the MCAT and I already felt like, okay, I have issues with standardized exams because I just never really had someone teach me how to take these tests. And so test anxiety was becoming more of an issue. I was dealing with insomnia, especially during cardiopulm. It was a very difficult block. I felt like everything got very real during that block. And I was depending on a lot of my friends, which most of them are minorities, and we were all sharing our own struggles. And I noticed that people that never showed that they were worried or struggling about their academics, some of them ended up like taking a year off, leaving, getting kicked out, or things like that. And I realized, that it's important to know that just because someone is quiet and they're not able to voice that they're struggling or need help, that they really might be, in need of your help, and making sure you're checking in and asking them and figuring out what we can do to help them. So don't assume that everyone is okay, because a lot of medical students are struggling and we just don't talk about it. And it's important that we start to have those conversations. So just remember, you're not your scores. I personally didn't honor anything in medical school. I was getting like 88%, and that was all I could do. I was studying 8 to 10 hours a day, and I realized that my definition of academic excellence is different than the definition that perhaps OSU has, and that was enough for me. This meme right here, I love it because this is definitely me during the first 2 years of medical school. I felt like there was a lot going on. There was a lot of heat. I was doing everything I could, and I was apparently only average, and average is perfectly fine with me, and I own being average. So just remember, you're not your score. You're a lot more than just an exam score. So after my first 2 years of medical school, it was time to take the scary, scary exam. Step 1, which we all know is the scariest thing in med school. I was not hitting my scores during my practice exams, and I didn't know what field of medicine I was going to go into. And so I didn't want to just pass. I wanted to take the exam and sit down and be confident that I was going to perform well. And so I was struggling with meeting the score that I wanted. And then I was also having a lot of issues with my personal life, a lot of family deaths, one of which was my 15-year-old cousin who committed suicide. And so, I kept pushing myself to keep studying, and I realized I wasn't, progressing at all. And I had to take time off, and I felt like a failure. I felt like I was supposed to finish medical school in 4 years, like everyone else. I wanted to graduate with my friends, but, I had to step back and realize I needed help. I needed to mourn the loss of my family and, figure out how I was going to do well on STEP. And so I decided I was going to take a year off, and I focused on my wellness. I went home to be with my family in West Chicago, and it really sucked because I couldn't break my lease. So I had to find a job and work and pay for my lease in Columbus, even though I wasn't living here. But, as with everything else, I was like, this is just another obstacle. I'll get over it. I'll find a way to fix it. And so I focused on my wellness. I started doing cognitive behavioral therapy, which really changed my life. It made me realize that I had a lot of negative thoughts, and most of it came from my childhood of always being worried about the future and were we going to have enough money to pay for our bills that month. And, all of that just made me feel like my brain would automatically go to like the negative thoughts. And so it just changed everything, and I became a much more positive person. I focused on my happiness. I started getting involved with boxing again, and weightlifting and writing. And there were a lot of financial struggles as well. Like I said, having to pay for my rent, even though I had to study for step 1. I was working 60 hours a week. So I just stopped studying and I just focused on work. I actually had a friend who reached out to me and said, are you going to come back to medical school? And I was really sad when she messaged me that, like, did you take step 1 already? Because I was actually at a funeral when she texted me that. And I wish that she would have just asked me, how are you doing? How are you? Not how's the exam or how's the studying? Because sometimes you just need a friend. And I think in medical school, you focus so much on the scores, you forget about the human aspect of all of this. And we're all human and we all struggle and we need each other and we need support. But I will say that I am very blessed. I took this year off, and if you ever need time off, it's completely okay to do it. I mean, I'm interviewing now. Everything has gone great. I enjoyed my 3rd and 4th year of medical school because I took time off. And I honestly think that, more people should take time off, honestly. So I think that this chronic stress and anxiety is really contributed to the culture of medicine. We are, so focused on knowing everything, and it causes so much chronic stress and anxiety on us. Like, we have to know everything. We have to be the best, and also, be there for our communities, and there's just a lot of burden. And another thing is that a lot of, medical students feel like they can't stand up to like ask for days for mental health, or, we just don't have time. I saw a research study that showed that minorities actually experience recurrent mistreatment. And so it's important that if you do see acts of racism, that you speak up, that you're an ally and help us. And even if you're afraid to report it or say something to the person who committed the act, that you talk to the medical student and tell them, hey, I saw what happened. I'm here for you. How can I support you? Because that really, truly makes a difference. And another obviously huge problem is depression and anxiety among medical students. According to the American Medical Student Association, medical students are 3 times more likely to die by suicide than our peers. And so, again, this is a huge problem, and we are talking more about it, but we need to find more ways to take action, and go a lot more than just, a lecture about wellness. We need to change our curriculum so that it's easier to learn these things, so that we have more time to focus on well-being. And I think it's also extremely important to be transparent and share your story. Personally, since I became more open about sharing my anxiety and my testing issues, I have had people come and tell me about their own anxiety. I had 2 medical students come talk to me about suicidal ideations, and I'm grateful and blessed that they came to me and talked to me and shared this with me, because I was able to figure out a safety plan with them. But it's scary to know that this is happening. I have friends who are med students at other institutions who have lost medical student friends to suicide. And so we need to really just keep this conversation going and make institutional change to prevent this from happening. So one of the biggest lessons that I learned from taking this year off is just like embracing your journey. We all have different journeys, and you have to just go with it and flow with it, because I am so thankful that my journey led me to take a year off. I had so many incredible opportunities. I got involved with politics. I worked for a state representative who's actually from West Chicago. She's one of my friends. She was a social worker who actually now just became the senator. And, you know, she's one of my friends. She's advocating for healthcare. And I am just so happy that I was able to have the opportunity to meet with her and work with her. And I've also met a lot of mentors, especially during that year off, who are from Chicago, who are also in emergency medicine. And it opened so many doors for me and has shown me that my mission is to, you know, run for office as a physician and make that institutional change. It also, you know, made me embrace self-care and how important it is that you continue to take care of yourself so you can actually take care of your patients. Don't neglect yourself. Like, there's just so many things will go wrong if you do that. And also ask for help when you need it. No one's going to know that you're struggling unless you speak up. So just please, 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 if you need help, if you're struggling, like, you can send me an email, text me. Like, we're here to help each other out, and we just need to do a better job about being transparent and being vulnerable. And, you know, obviously, as you've seen with all my involvement, I'm someone who doesn't really like, I'll use my voice and be an advocate, even when I have people telling me, you need to be careful with what you post on social media because residency programs might wonder if you're just going to go there and like start random protests. And, you know, I look back and I've told my friends this. I don't want to go to a residency program that won't support me when I'm fighting social justice issues or fighting against racism or police brutality. And so I think that, you know, you need to follow your heart and be passionate about what you love and do it unapologetically because you deserve to do so. And I've actually had a lot of people interviewing me for residency who ask me about all these things, and they love it. They care about it because, I mean, we should care about it. These are important issues and we should be doing something about it and not being silent. So embrace who you are, embrace everything that happens, and keep pushing yourself forward. So this is actually something really cool. I actually got to meet one of my my heroes, who is Jorge Ramos. He is a Spanish language news anchor, and honestly, like, every single Mexican that I know knows who this man is because he's always showing us what's happening in the world, and he does it without caring who's going to come for him or what's going to happen. And it was really nice to meet my hero, and one of his quotes that I really love is, "You have to challenge authority. Be a rebel. Your most important social responsibility is to prevent the abuse of those who are in power. Question them." I personally don't consider myself a rebel. I think I'm just someone who believes in social justice and uses my voice to help those that are marginalized and oppressed. And I think that if we had more people who did that, then people like me wouldn't be considered rebels. We would just be regular people trying to make a change. But it was wonderful that I had this opportunity to meet him. And it was because I took a year off, and, you know, so many other amazing things happened. So here is another quote that I found that kind of just, you know, encompasses everything I've been talking about as far as medical students and what we can do to change and improve what's happening. So there's a lot of suffering among medical students, residents, and physicians. As leadership, we can act to decrease their suffering. We can be a voice for cultivating compassion. This was said by Dr. Smith, who is a professor at UCSD. So it comes with starting with the conversation. How do we help these students? What's going on? And how do we take leadership and change this? So during my year off, I realized how, like, all the stigma that exists behind the mental health among the Mexican community. I remember I told my mom, I'm so anxious, I'm so worried. And she just said, like, you know, I don't know why you want to see a psychiatrist or a therapist. Like, you just need to pray it off. Like, clearly, you just need to pray and he'll take it away. And there's so much pride as well. Like, you know, you don't ask for help. A lot of Latinos will not ask for help until they're like literally dying and in the hospital. And so it's important to like have conversations with your patients about these things and figure out what's the root cause of all of this. But I talked to my mom and I said, I really think I need therapy, so I'm going to go ahead and do it, even though they think that it's only for the weak or the crazy. And so, these are real things that people actually think. They don't think that it's like, a biological imbalance with serotonin. And so we need to educate our communities as well and remind them that it's not weakness, that we just need to seek help when we need it. And my mom actually discouraged me from continuing medical school. She saw I was so anxious and she wondered if perhaps I was doing the wrong thing. So it was hard. It was very disheartening to hear my mom say that, but she just wanted the best for me. She didn't want to see me stressed out all the time. So a lot of reasons as well for why, it's difficult to access mental health services if you're Latino is all the language barriers. There are very few, Latino psychiatrists in the country, and it's difficult to use an interpreter for this, especially when it's very sensitive information. And so that's why, as well as, all the myths that are among your culture that prevent you from getting the help. You don't want people to label you as, the crazy person who's seeing a psychiatrist. So here are just some more quotes. This was from a Cleveland Clinic physician explaining the biological underpinnings of mental health disorders is enlightening by many Latinos. When they understand the chemicals, they start to feel like this is actually a real disease, whereas for the most part, they think it's made up. A lot of people actually that I know have told me they think it's like a thing that white people came up with just so that they could get like medications. And so they're like, oh no, that's not for you. That's not for our people. And so it's because they're just not educated about this, and just continuing that conversation is important. And again, kind of this goes back to what I was saying about when you have a Latino who comes and asks for help, they're really struggling because it's so hard. It's part of our culture. We're just very stubborn people that, don't like to ask for help. And we need to just keep reminding each other that it's okay to ask for help. So I mentioned writing as one of the opportunities that I had on my year off. I actually, started writing to cope with all my stress in the morning and all that stuff. And I wrote a little chapter on imposter syndrome that was actually published in a book in the Hispanic Stars Rising, The New Face of Power. And it's all about imposter syndrome and, what I felt like struggling with the MCAT, being a first generation, going to be the first Latina physician in my family. And, I felt like there's so much power that comes when you share your story, especially about your struggles, because people connect with you more and they realize, that you're someone who's open and willing to listen to them as well. And so I started writing. This was one of the examples, but then I also realized that I wanted to write more than just about my experience in medical school. So I'm currently working on a memoir where I talk about my upbringing, my childhood, having all these doubts and being first generation and still being here. And I actually found a mentor, Dr. Harper, who wrote the Beauty in Breaking book, and she's actually now my mentor. She's an emergency medicine doctor, and she wrote this beautiful book that I highly recommend about her struggles, being in an abusive family, as well as like the racism that she's experienced in the medical field. And it's amazing that we connected and that she's now my mentor. We started a book club here at OSUCOM. Sheila O'Care is an M3 who started a Physicians for Human Rights here. The chapter just started a couple of months ago. So we started this book club where we are meeting with the warden and people who are incarcerated and talking about correctional medicine and how we can, as medical students, improve the care for people who are incarcerated. And it's wonderful that she's able to join us in these meetings as well. So all of my experiences really pushed me to do research and just figure out like what's preventing medical students from getting mental health services help and all that. And I was involved with a research study, and OSUCOM was, one of the schools that was part of a study. And we found that 1 in 4 students actually experience barriers to treatment, which comes in various forms. It could be their access to effective treatment. Some people wish that they had, a provider who looked like them, just the outreach to specific groups like minorities. and as well as having protected time for appointments. A lot of us don't have the time, and we're nervous that perhaps our evaluations, will be negatively impacted because we took time off, or you don't want to tell people where you're going because you don't want people, again, to think that you're struggling, that you're weak, or whatever the case may be. And so we have to realize that you can't just do research. Like, the most important thing about research is, how do you implement what you find? What are we going to do about it now that we know that these are their barriers, and how do we move forward from here? Something that's been so important during my whole journey is finding my support system. I would not be here today if it wasn't for all the people who keep cheering me on, even when I've been at my lowest, all the people who, send me messages, emails, who consistently support me. And that's in the form of my friends, my family, and even people like Dr. Stone and the Bowen Circle. I'm so thankful that I became part of the Bowen Circle. I actually joined because I was nominated and received the award for Women in Excellence, and I am so thankful that I've been part of it, because we have so many conversations where we have undergrad students, physicians, med students come together and talk about their personal struggles, and that really gives all of us hope. And we need more of those groups, because it really makes a difference when you share your story, you're transparent, and you're vulnerable. You really touch a lot of lives. So there's just some pictures of some of my amazing friends and all the people who've changed my life and supported me along the way. And so just a little bit more of, these people who have doubted me. When I started college, I had a professor say, "Who wants to be a physician?" So all of us basically raised our hand, and he's like, "Only 2 or 3 of you will make it." And I told myself, that will be me. And I've just had so many people doubt me. I had people tell me, "You should go to nursing school instead. Perhaps this is too difficult." And I kept proving them wrong. And the point is not that, my purpose was to prove them wrong. It's just that you don't know my story, you don't know who I am, and you shouldn't be telling me what I can and cannot accomplish. And that's why I included this quote here, because I absolutely love it. Unless someone can look into the core of your heart to see the degree of your passion, or look into the depths of your soul to see the extent of your will, then they have no business telling you what you can or cannot accomplish, because while they may know the odds, they do not know you. And so do not allow what anyone says to, take over your dreams or to put you down. Like, just keep fighting for what you believe in. And, it's, you have to believe in yourself. Don't let other people form their own views and about you and what you can accomplish. I actually had a physician tell me that the programs that I want to go to for emergency medicine are la creme de la creme. They only take people who are like the nation's top. And I've actually received interviews at all of the programs that I considered my top programs. And so it just goes to show that, like, their definition of academic excellence is different than what other people have and what my own definition is. And so I'm glad that I didn't listen to them, and I still applied to those programs, because I don't know where I'm going to match, but I'm happy and thankful and above all blessed that I have been given the opportunity to interview at my favorite programs. So don't let other people, you just stunt on your daughters, because there's so much that you can do and you can't give up because of what somebody says to you. And we really need to do a better job of normalizing average at Ohio State. There's so much we can do, especially when it comes to grades, and other schools who aren't as strict about how difficult it is to honor. So there's a lot of work to be done, but I think we're heading in the right direction. So I wanted to end by just focusing a little bit on what happens now. Like, how do we move on from here? I have had a lot of conversations with classmates who don't identify as a minority, and they're like, "What do I do? How can I help?" And I'm like, honestly, it starts with a conversation. Like, get to know us, get to know the minority students, figure out, what we need and how you can help us. Come to our meetings, LMSA and SMMA. We're not inclusive. We want you guys there. We are inclusive. Sorry. We want you guys to join us. I was really disappointed that I didn't have, like, almost everyone who joined our meetings were minorities. And I wish we would have had more people join us, because, that's how we create change. When we have people who don't look like you, who come and listen and try to support you. If you see acts of racism, speak up. report misconduct, especially if it's on the behalf of students who are less privileged, who are even more scared than you are to report that. Institutional accountability for retention efforts. Again, it's not just about the recruitment and having the students here. How many of them are actually graduating on time? How can we help them listen to our needs and find a way to change what's happening with the retention? We also need to recruit diverse faculty. It would be nice to see people who look like me, who are physicians, and be more comfortable with knowing that I too will make it and will be in that leadership position as well. So don't just talk about it, be about it and do it. Support mental health initiatives, talk to medical students, check on them, remind them that they're not just their score, and also get to know your patients and your community and figure out how you can help them and how you can support them. Silence is the voice of complacency. We really need to continue to advocate and push for change, because that's how change happens. These are my references, and that is it.
Thank you so much, Jessica. Thank you for telling us about your story. It was great to hear more about you, more of your journey that you've been through, and just being so vulnerable throughout this whole situation, to be truthful to kind of what you went through. I think that for a lot of medical students listening today, that, a lot of them may resonate with kind of what you said and use you as an example to kind of be a stepping stone to really focus on themselves again. So thank you for that. I did have a question for you. You talked a lot about mentorship. Within those mentorship relationships, what was it that was probably most inspiring or probably the most important to you?
I would say, as far like my mentoring or me mentoring others.
Those mentoring you, and then we can also do the reverse right afterwards.
So honestly, I think the most inspiring was just having Dr. Vega be part of my life, like seeing someone like her in leadership who looked like me. It really just changed my whole perspective of how I saw myself, and it made me realize, like, hey, I can do this as well. Here's someone who looks like me, who's paving the way for other people. And that's why I became really involved with mentoring, and I have mentors in high school. I have, or mentees in high school, mentees in college, and some of them have been getting interviews for medical school. And it just makes me really happy because they look up to me. And even when they message me, like, I think mentorship is not even so much about the mentee, but like the way it makes me feel like, hey, I'm making a difference. They are seeing what I'm doing, and their messages just make me really happy and excited, and, look forward for them to get accepted into medical school.
I think that's great. Another question I have is, how did you come to wanting to go into emergency medicine? What factors kind of played into that, and how did you kind of land on that as your specialty of choice?
Yeah, so I actually came in thinking I was going to do primary care. And when I rotated through emergency medicine, I realized there was so much primary care. And I also realized that these social determinants of health are just so apparent in the emergency room. I mean, the people who are most marginalized end up in the ED because they don't have access to healthcare, and the emergency room is that gateway for them. If they don't see a doctor and they wait until like they're literally dying and come to the ED, I think it's important to have those conversations in the emergency room, because you really can be, bridging that gap between them and healthcare. And the way you treat them as an emergency physician determines the rest of their healthcare. And if you provide like a positive interaction and they can trust you and they see that you care, then they learn to trust our system. I think a lot of people, especially minorities and marginalized communities, don't trust our healthcare system because of our history. And I think in the emergency room, there's just so many avenues to be that change. And we're also at the forefront of a lot of this, there's social emergency medicine is like a curriculum now. And so all of that is what I love about emergency medicine, that you get to treat anyone and anything that walks through the door.
No, I love that. And I know I personally have a ton of stories from my rotations in the ED of how social determinants of health are really affecting those patients specifically. And I love that you tied it back to primary care, being someone going into family medicine myself. There is a lot of primary care in the emergency department, usually with those that are more underserved. So that is definitely a really great point. Now that you've finished medical school, what was your best memory of medical school? What made you joyful? What gave you hope?
Honestly, it's my friends, the people that, are leaving behind this legacy of changing our institution. A lot of my friends are leaders in so many different organizations with like Student National Medical Association. A lot of my friends are going into OB and they're super involved with advocacy for women's rights, and they want to get involved with global health as well. And so I've met some incredible people at Ohio State, and they're all working towards changing the way that healthcare is and how we can make systemic change. I mean, I've been to protests with some of my classmates and just seeing how passionate they are, and how willing they are to make a change is what's probably the happiest moments of my med school journey.
That's great. And part of the reason why we originally started medical student grand rounds is just for what you said. Medical students across the spectrum, across the classes, are doing great things, and we just really wanted to showcase that. So I'm glad that you brought that up. So I know in part of your action plan, one of the things that you said was that, you know, for someone who maybe looks like me, uh, we definitely see the importance of allyship.
Mhm.
Um, and you said that one of the things that we could do is, attend the LMSA meetings and SNMA meetings. When are those meetings, just so that we can advertise that a little bit here, to those that are watching right now?
Yeah, definitely. So usually what happens is in the beginning of the year when like all the organizations are trying to get people to get involved, like the SNMA and LMSA people send an email to everyone who's part of the medical school so that you could sign up. And from there, that's when you start getting like all the monthly or weekly emails from those organizations. I don't like right now, like we have a group me that's for like SNMA, and that's kind of where they post it. And so people can, if we can put, I can put my email in the chat, but I can put them in that group me. They send emails to the people who have initially are part of that listserv, who are part of the organization. But that there's definitely a way, like you have all the information of the SNMA and LMSA leadership on the OSU.com page as well.
Mhm.
You can also reach out to them personally, like, hey, can you add me to the listserv? I want to be part of this. Yeah.
And are there any plans, from LMSA or SMMA or some sort of collaboration to kind of target, those groups that, more look like me, that uh, in ways that we can be better allies, in this journey with you guys?
Yeah, I know like about 2 years ago, we actually like were trying to do forming a group where we had people, like we had some of our, like maybe two classmates who came and they're like, how do I get involved with you guys? And so they were white and they just want to know how they could help us. And we were trying to get more people to join, but it didn't work out. And so it's kind of hard and challenging because we already have like so much that we deal with, and it's hard for us to like consistently be making an effort to get you guys to come join. It would be nice if we didn't have to do those things. And you guys just kind of, try to have that conversation or made the effort to be like, hey, I want to join LMSA. I want to know what SNMA is all about, So, kind of having like um, just being more involved in that way, I would say, because there's already so much involvement with trying to fix what's going on in our communities. And something I forgot to mention, I'm glad you asked this question, is like when we have like our LG sessions, I often was almost always the only Latina in my group. And so I always felt like I was the one who had to like speak up or say something about like the Latino perspective, or like that whatever I said kind of represented my entire, background or Mexican culture. And sometimes that gets tiresome. Sometimes it really does. And it wasn't even a conversation. It was just me talking. But if someone would have engaged more and asked me questions, I would happily answer. You just don't always get that. And then it ends up just being like a one-way street.
I think that dialogue is definitely very important. I think that what you just talked about is a good call to action, really to everyone that, no matter what you look like, this is important. We need to support one another. So thank you for that. Kind of my last question is for our viewers out there. Do you have any last words of advice for anyone who may be going through, mental health challenges during medical school right now?
Yeah, definitely. I mean, I definitely want you guys to know that you're not alone. I think that most medical students, it's rare if you don't go through some type of mental health challenge. What we're doing is very difficult, and there's so many challenges, and we all have unique challenges, but really ask for help. I mean, we have amazing people here like Dr. Stone, we have amazing classmates. Just reach out to somebody, because you don't want to get to the point where you're struggling so much that you know, you get to a point where you feel like you can't continue. And so trying to prevent yourself from getting to a point where you feel like you can't finish med school, and that starts by just asking for help. Don't feel bad if you ask for help. Don't feel bad that you think you need mental health resources, a therapist, a psychiatrist. I know so many people who see a psychiatrist and a therapist who are med students. So just know you're not alone. There's a lot of people who are seeking that help.
I think that's excellent. Thank you so much, Jessica, for your perspective and what you brought to today's presentation. We really appreciate it.
Yeah, thank you. Thank you everyone who joined. I hope that you guys took away something from this and are inspired to either take action or not give up on your dreams.
Wonderful. So you have this QR code in front of you to provide feedback to the session, feedback to Jessica. We'd love to hear from you. Just a reminder that in 2 weeks, we're going to have a complimentary lecture from Krista Newkirk talking more on the Black medical student perspective of these exact same topics. So thank you so much, everyone, for joining us today, and I hope that you have a wonderful rest of your day.